Question 1. The review process indicates that during a subjective refraction, a patient expresses significant difficulty differentiating between the two lens options presented, stating they both look a little blurry. The certified ophthalmic technician, COT, is under time pressure to complete the examination. Which of the following actions best represents the appropriate professional response? Option A. Immediately revert to the retinoscopy findings, assuming they are more definitive than the patient's subjective response in this situation. Option B. Select the lens option that the technician subjectively believes is closer to the retinoscopic endpoint without further patient input. Option C. Gently explain that both options may appear slightly imperfect and ask the patient to indicate which one causes less strain or discomfort, even if the blur is similar. Option D. Reassure the patient that one option is likely better and encourage them to choose the one that appears less blurry, proceeding to the next step. The correct answer is D. Reassure the patient that one option is likely better and encourage them to choose the one that appears less blurry, proceeding to the next step. Explanation. This scenario is professionally challenging because it requires the certified ophthalmic technician, COT, to balance the need for accurate refractive data with the patient's comfort and ability to cooperate, all while adhering to established professional standards and ethical guidelines. The COT must recognize that subjective refraction is a collaborative process, and forcing a patient into a specific response without considering their input can lead to inaccurate results and a compromised patient experience. The correct approach involves patiently guiding the patient through the subjective refraction process, using clear and simple language to explain the choices presented. This includes acknowledging the patient's feedback, even if it seems ambiguous, and employing techniques to help them differentiate between lens options. This method aligns with the ethical obligation to provide patient-centered care, ensuring the patient understands the process and feels empowered to contribute to achieving the best possible visual outcome. It also adheres to the implicit regulatory expectation of providing competent and ethical care, which includes effective communication and patient engagement during diagnostic procedures. An incorrect approach that involves rushing the patient or dismissing their uncertainty is professionally unacceptable. It fails to meet the standard of care by not allowing adequate time for the patient to process the visual stimuli and make an informed choice. Ethically, it disrespects the patient's autonomy and their right to participate in their own healthcare decisions. Another incorrect approach, such as assuming the patient's preference based on minimal or unclear responses, introduces a significant risk of error in the refractive outcome. This violates the principle of accuracy in diagnostic testing and can lead to suboptimal vision correction, potentially requiring re-examination and causing patient dissatisfaction. Professionals should employ a decision-making framework that prioritizes patient understanding and cooperation. This involves active listening, clear communication, and a willingness to adapt the technique based on the patient's responses and perceived comfort level. When faced with patient uncertainty during subjective refraction, the COT should rephrase questions, use alternative comparison methods, or offer brief breaks to allow the patient to refocus, rather than pressuring them for a definitive answer. Question 2. The assessment process reveals a scenario where a certified ophthalmic technician, COT, is preparing to administer medications to a patient. The physician has prescribed both antibiotic eye drops for a corneal abrasion and a subconjunctival injection of an anti-inflammatory agent. The COT is reviewing the preparation steps for each. Which of the following accurately reflects the distinct procedural requirements for these two drug administration techniques? Option A. Eye drop installation requires sterile technique to prevent contamination of the dropper tip, whereas subconjunctival injections are considered a minor procedure and do not require strict aseptic protocols. Option B. Both eye drop installation and subconjunctival injection require meticulous hand hygiene and the use of sterile gloves, with the subconjunctival injection necessitating a sterile field and aseptic technique for the injection site. Option C. Subconjunctival injections require a sterile field and aseptic technique, while eye drop installation primarily focuses on patient comfort and ensuring the drop enters the conjunctival sac. Option D. Both eye drop installation and subconjunctival injection can be performed with clean technique, as the primary goal is to introduce medication into the ocular environment. The correct answer is B. Both eye drop installation and subconjunctival injection require meticulous hand hygiene and the use of sterile gloves, with the subconjunctival injection necessitating a sterile field and aseptic technique for the injection site. Explanation: the assessment process reveals a common challenge in ophthalmic practice, ensuring patient safety and efficacy during drug administration, particularly when multiple techniques are involved. The professional challenge lies in accurately identifying the correct technique for a given medication and route of administration, adhering strictly to established protocols and patient comfort. This requires a thorough understanding of drug properties, anatomical considerations, and the specific requirements of each administration method. The correct approach involves recognizing that subconjunctival injections are a sterile, invasive procedure requiring specific preparation, technique, and post-procedure care to prevent infection and ensure proper drug delivery into the subconjunctival space. This aligns with the ethical imperative to provide competent care and the regulatory requirement to follow established medical procedures for invasive treatments. The COT's role is to assist and prepare for such procedures, understanding the sterile field requirements and the potential for complications. An incorrect approach would be to confuse the sterile technique required for subconjunctival injections with the less stringent, though still clean, technique for instilling eye drops or ointments. Eye drops and ointments are topical applications, and while cleanliness is important to prevent contamination of the medication and the eye, they do not involve puncturing tissue. Misapplying sterile technique to topical applications is inefficient and can create unnecessary anxiety for the patient. Conversely, applying a non-sterile or less rigorous technique to a subconjunctival injection would be a grave ethical and regulatory violation, posing a significant risk of infection and harm to the patient. Furthermore, failing to recognize the distinct procedural requirements for each method demonstrates a lack of fundamental knowledge critical for patient safety. Professional decision-making in such situations requires a systematic approach. First, identify the medication and its intended route of administration. Second, recall or consult the specific protocol for that administration method, paying close attention to sterility requirements, patient positioning, and necessary equipment. Third, communicate clearly with the patient about the procedure and what to expect. Finally, always prioritize patient safety and adhere to all relevant guidelines and regulations. Question 3. Assessment of a patient presenting with sudden onset of severe eye pain, photophobia, and blurred vision reveals a hazy cornea with a visible stromal infiltrate and a significant epithelial defect upon slit lamp examination. The patient also reports recent contact lens wear. Which of the following diagnostic approaches is most appropriate for the certified ophthalmic technician to initiate under the supervision of an ophthalmologist? Option A. Advise the patient to discontinue contact lens wear and use over-the-counter lubricating eye drops until their next scheduled appointment. Option B. Rely primarily on the patient's reported symptoms to determine the severity of the condition and suggest immediate self-treatment. Option C. Perform a comprehensive slit lamp examination to assess corneal layers, transparency, and identify pathological changes, followed by pachymetry to measure corneal thickness. Option D. Focus solely on obtaining a detailed corneal topography map to evaluate the refractive properties of the cornea. The correct answer is C. Perform a comprehensive slit lamp examination to assess corneal layers, transparency, and identify pathological changes, followed by pachymetry to measure corneal thickness. Explanation: scenario analysis. This scenario presents a professionally challenging situation because the certified ophthalmic technician, COT, is faced with a patient exhibiting symptoms suggestive of a serious corneal condition. The challenge lies in accurately interpreting the patient's subjective complaints in conjunction with objective clinical findings, and then determining the appropriate next steps within the scope of practice and regulatory guidelines. Misinterpretation or delay in appropriate action could lead to significant vision loss for the patient. The COT must exercise careful judgment to differentiate between common, less severe conditions and those requiring immediate specialist intervention. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's symptoms, a thorough slit lamp examination to assess the corneal layers, transparency, and identify any pathological changes such as infiltrates, edema, or epithelial defects, and the use of pachymetry to measure corneal thickness. This comprehensive assessment allows the COT to gather critical data to support a diagnosis or differential diagnosis of conditions like keratitis or corneal ulcers. This approach aligns with the COT's role in assisting the ophthalmologist by providing detailed and accurate clinical information, adhering to established protocols for patient care and diagnostic procedures, as outlined by professional standards and regulatory bodies governing ophthalmic practice in the U.S. The COT's responsibility is to collect data that will enable the ophthalmologist to make a definitive diagnosis and treatment plan. Incorrect approaches analysis. Proceeding solely based on the patient's reported symptoms without a comprehensive slit lamp examination and pachymetry would be an ethical and regulatory failure. This approach neglects the objective clinical data necessary for accurate diagnosis and could lead to misdiagnosis or delayed treatment of a potentially sight-threatening condition. It bypasses fundamental diagnostic steps expected of a COT. Recommending over-the-counter lubricating eye drops without a definitive diagnosis and ophthalmologist order is also a failure. This constitutes practicing medicine without a license and exceeds the COT's scope of practice. It also risks masking or exacerbating a serious underlying corneal pathology. Focusing only on corneal topography without considering the other clinical signs and symptoms would be incomplete. While topography is crucial for assessing refractive properties and identifying certain dystrophies or irregularities, it does not provide information about inflammation, infection, or epithelial integrity, which are critical for diagnosing keratitis or ulcers. This narrow focus would miss vital diagnostic clues. Professional reasoning. Professionals should approach such scenarios by prioritizing patient safety and adhering to their defined scope of practice. The decision-making process should involve 1. Active listening to the patient's subjective complaints. 2. Performing a thorough, systematic objective examination using appropriate instrumentation, slit lamp, pachymeter. 3. Correlating subjective and objective findings. 4. Documenting all findings accurately. 5. Communicating findings and concerns to the supervising ophthalmologist promptly. 6. Following the ophthalmologist's instructions for further diagnostic tests or treatment. This structured approach ensures that all necessary information is gathered to facilitate an accurate diagnosis and appropriate patient management, thereby upholding ethical obligations and regulatory compliance. Question 4. Upon reviewing the clinical presentation of a patient with a newly diagnosed anterior uveitis, which of the following approaches best reflects a comprehensive risk assessment for potential underlying systemic etiologies? Option A. Immediately referring the patient to a rheumatologist without further ocular investigation or consultation with the supervising ophthalmologist. Option B. Conducting a thorough patient history review, inquiring about recent infections, autoimmune conditions, or other systemic complaints, and correlating these findings with the ocular presentation. Option C. Relying solely on the ophthalmologist's initial assessment and not performing an independent risk stratification of potential systemic links. Option D. Focusing solely on the immediate management of the uveitis symptoms and assuming a localized ocular cause. The correct answer is D. Focusing solely on the immediate management of the uveitis symptoms and assuming a localized ocular cause. Explanation. This scenario presents a professional challenge because the certified ophthalmic technician, COT, must balance the immediate need to provide patient care with the ethical and regulatory obligation to accurately assess and communicate risk. The COT's role involves more than just technical proficiency. It requires sound clinical judgment and adherence to professional standards that prioritize patient safety and informed decision-making. Misinterpreting or downplaying potential risks can lead to delayed or inappropriate treatment, negatively impacting patient outcomes and potentially violating professional conduct guidelines. The correct approach involves a comprehensive risk assessment that considers all available clinical data, patient history, and potential contributing factors to the observed ocular pathology. This approach is justified by the ethical imperative to act in the patient's best interest and the regulatory framework governing COT practice, which mandates thorough patient evaluation and accurate reporting. Specifically, the COT is expected to identify and communicate potential risks to the supervising ophthalmologist, enabling timely and appropriate management. This aligns with the principle of beneficence and non-maleficence in patient care. An incorrect approach that focuses solely on the most obvious symptom without considering underlying systemic or contributing factors fails to meet the standard of care. This oversight can lead to a superficial understanding of the patient's condition and a missed opportunity to identify serious underlying issues, potentially violating the duty of care. Another incorrect approach that involves prematurely concluding the diagnosis without a thorough risk assessment and consultation with the ophthalmologist is a direct violation of professional scope of practice and regulatory guidelines. COTs are trained to assist in diagnosis, but not to make definitive diagnoses independently. This premature conclusion can lead to misdiagnosis and inappropriate treatment plans, posing a significant risk to the patient. A further incorrect approach that involves dismissing potential risks due to a lack of immediate, overt signs of severe pathology is also professionally unacceptable. Ocular diseases can be insidious, and a proactive risk assessment should consider even subtle indicators or patient-reported symptoms that might suggest a developing problem. This approach neglects the principle of vigilance and proactive patient management. The professional decision-making process for similar situations should involve a systematic approach. First, gather all relevant patient information, including history, symptoms, and objective findings. Second, analyze this information to identify potential risks and contributing factors, considering the differential diagnoses. Third, consult with the supervising ophthalmologist, clearly and concisely communicating the findings and the assessed risks. Finally, document all findings, assessments, and consultations thoroughly. This structured approach ensures that patient care is based on comprehensive evaluation and collaborative decision-making, adhering to both ethical principles and regulatory requirements. Question 5. Risk assessment procedures indicate a patient presence with a history of ocular hypertension and a family history of glaucoma. During the anterior chamber assessment, the certified ophthalmic technician, COT, notes a visually narrow angle. Which of the following actions best aligns with the COT's professional responsibilities and regulatory framework in the United States? Option A. Inform the patient that their narrow angle indicates they have glaucoma and advise them on lifestyle changes to manage their condition. Option B. Recommend over-the-counter eye drops to the patient to help widen their anterior chamber angle. Option C. Proceed with the anterior chamber assessment without further comment to the patient, as the COT's role is solely to perform tests and not to discuss potential diagnoses. Option D. Perform gonioscopy to objectively assess the anterior chamber angle, accurately document the findings, and report them to the supervising ophthalmologist for diagnosis and management. The correct answer is D. Perform gonioscopy to objectively assess the anterior chamber angle, accurately document the findings, and report them to the supervising ophthalmologist for diagnosis and management. Explanation. This scenario is professionally challenging because it requires the certified ophthalmic technician, COT, to integrate knowledge of anterior chamber anatomy and aqueous humor dynamics with patient communication and ethical considerations, all within the scope of practice defined by U.S. regulations governing ophthalmic technicians. The COT must accurately assess anterior chamber depth, a critical component in glaucoma risk stratification, while ensuring the patient understands the implications of the findings without overstepping professional boundaries or providing a diagnosis. The challenge lies in balancing technical proficiency with patient education and adherence to regulatory guidelines that define the COT's role as an assistant to the ophthalmologist. The correct approach involves the COT performing a standardized assessment of anterior chamber depth using appropriate instrumentation and techniques, documenting the findings accurately, and then communicating these objective findings to the supervising ophthalmologist. The COT's role is to gather data and present it to the physician, who is responsible for diagnosis and treatment planning. This aligns with the ethical principle of beneficence, acting in the patient's best interest by providing accurate data, and non-maleficence, avoiding harm by not diagnosing or providing treatment advice. Regulatory frameworks, such as those overseen by the American Association of Certified Ophthalmic Technicians, ACOTO, and state licensing boards, define the scope of practice for COTs, emphasizing their role in data collection and assisting the physician, rather than independent diagnosis or patient counseling on medical conditions. An incorrect approach would be for the COT to interpret the anterior chamber depth measurement and directly inform the patient that they have a narrow angle and are at high risk for glaucoma. This constitutes practicing medicine without a license, a violation of state medical practice acts, and a breach of ethical conduct. It bypasses the ophthalmologist's diagnostic authority and could cause undue patient anxiety or lead to self-treatment decisions. Another incorrect approach would be for the COT to perform the assessment, but then fail to document the findings or report them to the ophthalmologist. This violates the principle of fidelity, faithfulness to duties, and could lead to delayed or misdiagnosis and treatment for the patient, potentially causing harm. It also fails to meet the professional standard of care for accurate record-keeping and communication within the healthcare team. A third incorrect approach would be for the COT to dismiss the patient's concerns about their vision and proceed with the anterior chamber assessment without acknowledging the patient's subjective experience. While the COT's primary role is objective measurement, professional practice requires acknowledging the patient's reported symptoms and relaying them to the physician. Ignoring patient input can erode trust and hinder comprehensive care. The professional decision-making process for similar situations involves a clear understanding of one's scope of practice, adherence to established protocols for patient assessment and documentation, and effective communication with the supervising physician. When faced with a situation that borders on diagnostic interpretation or patient counseling, the COT should always err on the side of caution, focusing on accurate data collection and reporting, and deferring any diagnostic or treatment-related discussions to the ophthalmologist. This ensures patient safety, maintains professional integrity, and complies with regulatory requirements. Question 6. Performance analysis shows a patient presents with a visual field defect that appears to respect the vertical midline, suggesting a potential lesion affecting the optic chiasm or optic tracts. As a certified ophthalmic technician, COT, what is the most appropriate action to take in assessing and reporting these findings? Option A. Focus only on the technical quality of the visual field test and disregard the specific pattern of the defect if it seems unusual. Option B. Conclude that the visual field defect is a result of age-related changes and requires no further investigation. Option C. Immediately inform the patient that they likely have a brain tumor based on the visual field defect pattern. Option D. Document the specific pattern of the visual field defect, noting its characteristics and location, and clearly present these findings to the supervising ophthalmologist for their diagnostic interpretation. The correct answer is D. Document the specific pattern of the visual field defect, noting its characteristics and location, and clearly present these findings to the supervising ophthalmologist for their diagnostic interpretation. Explanation. This scenario is professionally challenging because it requires the certified ophthalmic technician, COT, to interpret complex visual field data and correlate it with potential neurological deficits, which extends beyond basic technical skills into diagnostic interpretation. The COT must exercise careful judgment to ensure accurate reporting and appropriate patient referral, adhering strictly to the scope of practice defined by the certified ophthalmic technician, COT, regulatory framework. The correct approach involves meticulously reviewing the visual field test results, identifying patterns consistent with specific visual pathway defects, and documenting these findings accurately for the ophthalmologist's review. This aligns with the COT's role in assisting with patient diagnosis and management by providing objective, high-quality data. The regulatory framework for COTs emphasizes the importance of precise data collection and reporting to support the ophthalmologist's diagnostic process. Ethical considerations also mandate that the COT does not overstep their defined scope of practice by making definitive diagnoses, but rather presents findings that aid the physician. An incorrect approach of immediately assuming a specific neurological condition without comprehensive ophthalmological correlation fails to respect the established diagnostic hierarchy and the COT's defined role. This could lead to premature conclusions, potentially misdirecting further investigation and causing undue patient anxiety. Ethically, it represents an overreach of professional boundaries. Another incorrect approach of dismissing subtle visual field abnormalities as insignificant, even if they deviate from a normal pattern, is professionally unacceptable. The COT's responsibility includes identifying and reporting all relevant findings, even those that may not immediately appear critical, as they could be early indicators of significant pathology. Failure to report such findings violates the duty to provide thorough and accurate patient care. A further incorrect approach of focusing solely on the technical execution of the visual field test without considering the clinical implications of the results is also flawed. While technical proficiency is crucial, the purpose of the test is to gather information that aids in diagnosis. Ignoring the interpretive aspect of the data, even at a preliminary level, diminishes the value of the COT's contribution to patient care. The professional reasoning process for similar situations should involve a systematic review of the visual field data, cross-referencing findings with patient history and other clinical information available, and clearly documenting all observations for the supervising ophthalmologist. The COT should always operate within their defined scope of practice, recognizing when findings require further expert interpretation and referral. Question 7. Implementation of an optical coherence tomography (OCT) scan for a patient presenting with blurred vision, where the patient expresses significant anxiety about the procedure and asks, "What do you think this scan will show?" What is the most appropriate immediate action for the certified ophthalmic technician (COT)? Option A. Proceed with the OCT scan without further discussion to avoid delaying the diagnostic process. Option B. Explain to the patient that the OCT scan appears to show early signs of diabetic retinopathy based on the current imaging. Option C. Reassure the patient that the scan is routine and explain that the ophthalmologist will discuss all findings after the examination is complete. Option D. Ask the patient to sign an additional consent form, specifically detailing potential OCT findings before proceeding. The correct answer is C. Reassure the patient that the scan is routine and explain that the ophthalmologist will discuss all findings after the examination is complete. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified ophthalmic technician (COT) to balance the immediate need for accurate diagnostic imaging with the patient's comfort and the ethical imperative to obtain informed consent. The COT must understand the principles of optical coherence tomography (OCT) interpretation to identify potential abnormalities, but also recognize the limitations of their role and the necessity of physician involvement for definitive diagnosis and treatment planning. The risk lies in either overstepping professional boundaries by attempting to diagnose or underestimating the importance of patient communication and consent, potentially leading to patient distress or legal repercussions. Correct approach analysis. The correct approach involves the COT performing the OCT scan according to established protocols, ensuring image quality for subsequent interpretation by the ophthalmologist. This includes properly positioning the patient, acquiring the necessary scans, and performing preliminary quality checks. The COT then accurately documents the findings and presents the raw data to the ophthalmologist for their professional interpretation and diagnosis. This aligns with the COT's scope of practice, which emphasizes technical proficiency in diagnostic imaging and data acquisition, not independent medical diagnosis. The American Academy of Ophthalmology (AO) Guidelines and the Joint Commission on Allied Health Personnel in Ophthalmology (JCOPO) Code of Ethics underscore the technician's role in assisting the physician and maintaining patient confidentiality and safety. Incorrect approach is analysis. An incorrect approach would be for the COT to attempt to explain the OCT findings to the patient, suggesting a specific diagnosis such as early signs of macular degeneration. This is a failure to adhere to the scope of practice for a COT, as diagnosis is the exclusive domain of the licensed ophthalmologist. Ethically, this constitutes practicing medicine without a license and can lead to patient anxiety and misinformed decisions. It also violates the principle of professional responsibility, as the COT is not qualified to make such pronouncements. Another incorrect approach would be to proceed with the OCT scan without confirming the patient's understanding of the procedure and its purpose, especially if the patient expresses apprehension. While the COT may have obtained a general consent for the examination, specific consent for the OCT, including its purpose and potential findings, is crucial. Failing to ensure adequate patient understanding and consent, particularly when the patient is expressing concerns, violates patient autonomy and can lead to a breach of trust and potential ethical complaints. A third incorrect approach would be to dismiss the patient's concerns about the OCT procedure and proceed with the scan without addressing them. This demonstrates a lack of empathy and professionalism, potentially exacerbating patient anxiety. While the OCT is generally a safe procedure, patient apprehension must be acknowledged and addressed within the COT's capabilities, or escalated to the ophthalmologist if necessary. Ignoring patient concerns can lead to a negative patient experience and compromise the quality of the examination due to patient movement or lack of cooperation. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety, ethical conduct, and adherence to their defined scope of practice. This involves 1. Understanding and respecting the boundaries of their professional role as defined by regulatory bodies like COT and professional organizations like the AAO. 2. Prioritizing clear and effective communication with the patient, ensuring informed consent and addressing any concerns. 3. Recognizing when to escalate issues or findings to the supervising ophthalmologist. 4. Maintaining meticulous documentation of all procedures and patient interactions. In situations involving diagnostic imaging, the COT's primary responsibility is accurate data acquisition and presentation to the physician, not independent interpretation or patient counseling on medical conditions. Question 8. Which approach would be most appropriate for a certified ophthalmic technician, COT, when a patient reports new visual disturbances and is taking a systemic steroid for a chronic condition? Option A. Provide the patient with a list of common ocular side effects of systemic steroids and instruct them on how to manage these symptoms independently. Option B. Reassure the patient that their visual disturbances are likely unrelated to their systemic steroid medication and focus solely on their current ocular complaint without further investigation into medication effects. Option C. Advise the patient to immediately stop taking their systemic steroid medication until their vision improves, as steroids are known to cause eye problems. Option D. Document the patient's reported visual disturbances and ocular findings, research potential ocular side effects of systemic steroids, and promptly communicate all information and concerns to the supervising ophthalmologist for their assessment and management plan. The correct answer is D. Document the patient's reported visual disturbances and ocular findings, research potential ocular side effects of systemic steroids, and promptly communicate all information and concerns to the supervising ophthalmologist for their assessment and management plan. Explanation. Scenario analysis. This scenario presents a common challenge in ophthalmic practice where a patient's systemic medication may be causing ocular side effects. The certified ophthalmic technician, COT, must recognize the potential link between the medication and the patient's symptoms, understand the implications for ocular health, and act appropriately within their scope of practice and ethical guidelines. The challenge lies in accurately identifying the causative agent, communicating effectively with the patient and the supervising ophthalmologist, and ensuring the patient receives timely and appropriate care without overstepping professional boundaries. Correct approach analysis. The correct approach involves meticulously documenting the patient's reported symptoms and ocular findings, cross-referencing these with known ocular side effects of the patient's current systemic medications, and then promptly and clearly communicating these findings and concerns to the supervising ophthalmologist. This approach is correct because it adheres to the fundamental principles of patient care and professional responsibility. The COT's role is to gather and present objective data and potential correlations to the physician, who is ultimately responsible for diagnosis and treatment. This aligns with the ethical obligation to act in the patient's best interest and the regulatory framework that defines the scope of practice for ophthalmic technicians, which emphasizes assisting the ophthalmologist. Specifically, the COT is expected to recognize and report potential adverse drug reactions affecting the eye, facilitating prompt medical intervention. Correct approaches analysis. An approach that involves directly advising the patient to discontinue or alter their systemic medication is incorrect because it constitutes practicing medicine without a license and exceeds the COT's scope of practice. This action would violate regulatory statutes governing medical practice and could lead to serious harm to the patient if the medication is essential for managing their systemic condition. Furthermore, it breaches ethical guidelines by undermining the physician-patient relationship and the physician's authority. Another incorrect approach would be to dismiss the patient's symptoms as unrelated to their systemic medication, without thorough investigation or consultation with the ophthalmologist. This failure to investigate a potential drug-induced ocular condition could lead to delayed diagnosis and treatment of a serious side effect, potentially resulting in irreversible vision loss. This demonstrates a lack of diligence and a failure to uphold the professional standard of care. Finally, an approach that involves researching ocular side effects of systemic medications and presenting this information to the patient without involving the ophthalmologist is also inappropriate. While research is a valuable tool, the COT's role is to synthesize this information and present it to the supervising physician for their interpretation and clinical decision-making, not to directly educate or advise the patient on medical matters. This bypasses the physician's role and could lead to patient anxiety or misinterpretation of medical information. Professional reasoning. Professionals should employ a systematic decision-making framework when encountering potential systemic medication-induced ocular side effects. This framework includes 1. Thoroughly gathering patient history including current medications and reported symptoms. 2. Performing a comprehensive ocular examination noting all relevant findings. 3. Consulting reliable resources, e.g., drug information databases, ophthalmic literature, to identify potential ocular side effects of the patient's systemic medications. 4. Correlating patient symptoms and ocular findings with known drug side effects. 5. Documenting all findings and potential correlations meticulously. 6. Promptly and clearly communicating all relevant information and concerns to the supervising ophthalmologist, including the patient's symptoms, ocular findings, and potential medication links. 7. Awaiting the ophthalmologist's assessment and instructions for further management. This structured approach ensures that patient safety is prioritized, professional boundaries are respected, and the highest standard of care is maintained within the regulatory and ethical framework. Question 9. The analysis reveals a patient presenting with a red eye and mild discomfort. The redness appears diffuse and superficial. The patient denies any recent trauma or systemic illness. Based on the Certified Ophthalmic Technician (COT) scope of practice and regulatory framework, which of the following actions is the most appropriate initial step in assessing this patient? Option A. Recommend the patient schedule an appointment with a rheumatologist, as red eyes often indicate systemic autoimmune disease. Option B. Perform a detailed history, including the onset, duration, and character of the discomfort, and assess the extent and nature of the redness, noting any tenderness to palpation. Option C. Immediately inform the patient that they likely have episcleritis and advise them to use over-the-counter artificial tears. Option D. Document the redness and proceed to the next patient, assuming the condition is minor and will resolve on its own. The correct answer is B. Perform a detailed history, including the onset, duration, and character of the discomfort, and assess the extent and nature of the redness, noting any tenderness to palpation. Explanation. The analysis reveals a scenario where a certified ophthalmic technician, COT, must differentiate between episcleritis and scleritis based on clinical presentation and patient history. This is professionally challenging because both conditions involve inflammation of the sclera and episclera, can present with redness and discomfort, and require accurate diagnosis for appropriate management. Misdiagnosis can lead to delayed or incorrect treatment, potentially causing vision loss or systemic complications, particularly with scleritis. The COT's role is to gather and present objective data to the ophthalmologist, ensuring the diagnostic process is informed and efficient. The correct approach involves a thorough assessment of the patient's symptoms, including the nature and location of pain, the character of the redness, superficial vs. deep, and any associated systemic symptoms. This systematic data collection, adhering to established ophthalmic diagnostic protocols, allows the COT to provide the ophthalmologist with the most accurate and comprehensive information. This aligns with the COT's ethical responsibility to provide competent patient care and support accurate medical diagnosis, as implicitly guided by professional standards of practice, which emphasize meticulous observation and reporting. An incorrect approach would be to rely solely on the superficial appearance of redness without further investigation. This fails to acknowledge the deeper structural involvement and potential systemic implications of scleritis, which can be more diffuse and involve deeper tissues than episcleritis. Another incorrect approach would be to dismiss the patient's symptoms as minor without a detailed history and physical examination, neglecting the potential severity of inflammatory conditions. This overlooks the COT's duty to report all relevant clinical findings. Finally, an approach that involves suggesting a specific diagnosis or treatment plan without the direct supervision and order of the ophthalmologist would be a violation of professional boundaries and regulatory guidelines for COTs, who are not licensed to diagnose or prescribe. Professional reasoning in such situations requires a systematic approach. First, meticulously gather all subjective and objective patient data. Second, correlate findings with known clinical presentations of ocular conditions. Third, present this synthesized information clearly and concisely to the supervising ophthalmologist. And fourth, await and follow the ophthalmologist's diagnostic and therapeutic directives. This process ensures patient safety and upholds the scope of practice for a COT. Question 10. Strategic planning requires a certified ophthalmic technician to synthesize various diagnostic components when assessing a patient with suspected glaucoma. Given a patient presenting with reported difficulty seeing in dim light and occasional halos around lights, alongside a visual field test showing a superior arcuate scotoma and optic nerve imaging, revealing increased cup-to-disc ratio and thinning of the neuroretinal rim, which approach best demonstrates a comprehensive and integrated diagnostic process. Option A. Prioritize the visual field test results as they directly measure functional vision loss and recommend management based solely on this finding. Option B. Integrate all findings, patient symptoms, visual field results, and optic nerve head assessment to form a cohesive diagnostic picture and guide management decisions. Option C. Rely primarily on the optic nerve head assessment, as structural damage is the definitive sign of glaucoma, and disregard the visual field results if they appear inconsistent. Option D. Focus on the patient's subjective symptoms, assuming they are the primary indicator of disease progression, and adjust management accordingly without further objective correlation. Correct answer is A. Prioritize the visual field test results as they directly measure functional vision loss and recommend management based solely on this finding. Explanation. This scenario presents a professional challenge because the certified ophthalmic technician, COT, must integrate multiple diagnostic findings to formulate a comprehensive understanding of a patient's glaucoma. The complexity arises from the need to synthesize subjective patient reports, objective visual field data, and detailed optic nerve head assessments, all while adhering to established clinical protocols and ethical standards for patient care. Accurate interpretation and integration are crucial for effective management and preventing vision loss. The correct approach involves a systematic and integrated review of all available diagnostic data. This means correlating the patient's reported symptoms with objective findings from the visual field test and the optic nerve head examination. For example, if a patient reports noticing peripheral vision loss, the COT must verify if the visual field test confirms this deficit in the corresponding location, and if the optic nerve head assessment reveals corresponding structural changes indicative of glaucomatous damage. This integrated approach aligns with the ethical imperative to provide competent and comprehensive patient care, ensuring that all diagnostic information contributes to a holistic assessment. It also reflects the professional responsibility to utilize all available tools and data to accurately diagnose and manage ocular conditions, as expected within the scope of practice for a COT. An incorrect approach would be to solely rely on one piece of diagnostic information, such as only considering the visual field test results without correlating them with the optic nerve appearance. This failure to integrate data can lead to misdiagnosis or underestimation of disease severity. Ethically, this represents a lapse in due diligence and a failure to provide thorough patient assessment. Another incorrect approach would be to dismiss subjective patient complaints if they do not immediately align with initial objective findings, without further investigation or re-evaluation. This can lead to delayed diagnosis and treatment, potentially causing irreversible vision loss, and violates the ethical principle of patient-centered care. A third incorrect approach might involve making management recommendations based on incomplete or poorly correlated data, which is professionally irresponsible and could lead to inappropriate treatment plans. Professionals should employ a decision-making process that prioritizes a thorough and systematic review of all patient data. This involves 1. Understanding the patient's chief complaint and history. 2. Meticulously reviewing each diagnostic test result, visual fields, optic nerve imaging, intraocular pressure, etc. 3. Actively seeking correlations and discrepancies between these findings. And 4. Consulting with the supervising ophthalmologist when necessary to ensure a comprehensive and accurate diagnosis and management plan. This structured approach ensures that all relevant information is considered, leading to optimal patient outcomes. Question 11. The audit findings indicate a recurring pattern of incomplete documentation regarding patient education on the nature and potential progression of vitreous floaters, including the distinction between benign floaters and symptoms suggestive of posterior vitreous detachment or vitreous hemorrhage. What is the most appropriate immediate course of action for the certified ophthalmic technician, COT, to address this finding? Option A. Schedule a brief educational session with the ophthalmic team to review the standard protocol for documenting patient education on vitreous disorders, and to emphasize the importance of clearly distinguishing between benign floaters and signs of PVD or hemorrhage. Option B. Immediately implement a new, more detailed electronic health record template specifically for vitreous complaints, requiring extensive new data entry for every patient. Option C. Focus on ensuring the physician's dictation is more thorough, as the ultimate responsibility for the medical record lies with the physician. Option D. Advise the physician to simply add a standardized disclaimer about floaters to every patient chart to cover potential future issues. The correct answer is A. Schedule a brief educational session with the ophthalmic team to review the standard protocol for documenting patient education on vitreous disorders, and to emphasize the importance of clearly distinguishing between benign floaters and signs of PVD or hemorrhage. Explanation. Scenario analysis. This scenario presents a challenge because it requires the certified ophthalmic technician, COT, to interpret and act upon audit findings related to patient care documentation. The findings suggest a potential gap in the thoroughness of documentation concerning a common ophthalmic condition, vitreous floaters, and its potential progression to posterior vitreous detachment, PVD, or hemorrhage. The professional challenge lies in ensuring that all patient encounters are documented to a standard that reflects comprehensive assessment, patient education, and appropriate follow-up, as mandated by professional standards, and potentially by payer requirements for reimbursement. The COT must balance the need for accurate and complete records with the efficient use of their time and resources. Correct approach analysis. The correct approach involves reviewing the specific audit findings, cross-referencing them with established clinical protocols for managing vitreous disorders, and then implementing a targeted educational session for the ophthalmic team. This approach is correct because it directly addresses the identified deficiency by reinforcing best practices in documentation and patient management. It aligns with the ethical obligation of a COT to maintain accurate patient records and to ensure that patient care is delivered according to accepted standards. Furthermore, by focusing on education and protocol reinforcement, it promotes a proactive approach to quality improvement, which is a cornerstone of professional practice and is often implicitly or explicitly required by regulatory bodies overseeing healthcare quality. Incorrect approaches analysis. One incorrect approach involves dismissing the audit findings as minor or subjective, assuming that the current documentation practices are sufficient. This is professionally unacceptable because it ignores a potential indicator of suboptimal patient care or documentation. Regulatory frameworks and professional guidelines emphasize the importance of accurate and complete medical records for patient safety, continuity of care, and legal compliance. Failing to address audit findings, even if perceived as minor, can lead to systemic issues and potential regulatory scrutiny. Another incorrect approach is to immediately implement a new, complex documentation system without understanding the root cause of the audit findings. This is professionally flawed because it is a reactive and potentially inefficient solution. Without a clear understanding of why the current documentation is lacking, a new system may not address the underlying issues and could create additional burdens for the clinical team. Professional practice dictates a problem-solving approach that begins with analysis and targeted intervention, rather than a broad, unanalyzed overhaul. A third incorrect approach is to focus solely on the physician's documentation without considering the COT's role in patient assessment and education. While the physician ultimately signs off on the chart, the COT plays a crucial role in gathering information, educating patients about their condition, and documenting these interactions. Ignoring the COT's contribution to the overall documentation process, as suggested by the audit findings, is a failure to recognize the collaborative nature of patient care and can lead to incomplete records. Professional ethics and standards of practice require a holistic view of patient care documentation. Professional reasoning. When faced with audit findings, a professional decision-making process should involve 1. understanding the specific findings and their potential implications for patient care and documentation. 2. Consulting relevant clinical guidelines, protocols, and regulatory requirements. 3. Identifying the root cause of any identified deficiencies. 4. Developing and implementing targeted interventions, such as education or protocol refinement. 5. Monitoring the effectiveness of interventions and making further adjustments as needed. This systematic approach ensures that quality is maintained and improved in a responsible and effective manner. Question 12. The monitoring system demonstrates that a certified ophthalmic technician, COT, has been observed discussing a patient's specific antiviral eye drop prescription and dosage with a colleague in the main clinic hallway, within earshot of other waiting patients. The COT also left a printed prescription for the same patient on a shared administrative desk. What is the most appropriate course of action for the COT in this situation, considering the regulatory framework governing patient privacy and information handling? Option A. Inform the patient that their prescription details were inadvertently exposed and suggest they speak with the physician about privacy concerns. Option B. Document the incident in the patient's chart as a minor privacy lapse and continue with daily duties. Option C. Immediately retrieve the printed prescription, apologize to the patient if they are present, and refrain from discussing patient-specific treatment details in public areas. Option D. Continue the conversation with the colleague, assuming other patients are not paying attention and the information is not sensitive enough to cause harm. The correct answer is C. Immediately retrieve the printed prescription, apologize to the patient if they are present, and refrain from discussing patient-specific treatment details in public areas. Explanation. This scenario presents a professional challenge because it involves a potential breach of patient privacy and the unauthorized disclosure of protected health information, PHI, which is a cornerstone of ethical ophthalmic practice and is strictly regulated. The certified ophthalmic technician, COT, is entrusted with patient care and must uphold patient confidentiality at all times. The temptation to share information, even with good intentions, can lead to serious ethical and legal repercussions. Careful judgment is required to navigate the boundaries of professional responsibility and patient privacy. The correct approach involves adhering strictly to the Health Insurance Portability and Accountability Act, HIPAA, regulations. This means that any discussion of a patient's condition or treatment, including the prescription and administration of topical medications, must occur within a secure and private setting, and only with authorized individuals. The COT must ensure that patient information is not inadvertently disclosed in public areas or to unauthorized personnel. This upholds the patient's right to privacy and maintains the integrity of the healthcare provider-patient relationship, aligning with the ethical principles of beneficence and non-maleficence. An incorrect approach would be to discuss the patient's medication regimen in a public waiting area, even if the conversation is brief and seemingly innocuous. This action violates HIPAA by potentially exposing PHI to other patients or visitors, thereby breaching confidentiality. Another incorrect approach would be to leave prescription information or medication details visible on a desk or computer screen where it could be accessed by unauthorized individuals. This also constitutes a failure to protect PHI. A third incorrect approach would be to discuss the patient's specific diagnosis and prescribed antiviral medication with a colleague in a non-secure area, such as a break room, without ensuring the conversation is private and that no unauthorized individuals can overhear. This again risks unauthorized disclosure of PHI. Professionals should employ a decision-making framework that prioritizes patient privacy and regulatory compliance. This involves a constant awareness of the environment and the potential for PHI exposure. Before any communication involving patient information, professionals should ask, is this conversation private? Am I speaking only to authorized individuals? Is this information necessary for the current task? If the answer to any of these questions is no, the communication should be postponed or moved to a secure location. Adherence to established protocols for handling patient information, including secure disposal of documents and password protection for electronic records, is paramount. Question 13. Process analysis reveals a patient presenting with persistent ocular discomfort, characterized by a gritty sensation and intermittent blurred vision, which they attribute to dry eyes. The patient also reports a history of recurrent episodes of painful swelling and redness around the inner corner of their eye, diagnosed as dacryocystitis, which resolved with antibiotic treatment in the past. Considering this clinical presentation and history, what is the most appropriate initial management strategy? Option A. Initiate a trial of artificial tears and lubricating ointments and schedule a follow-up appointment in 4 weeks to reassess symptoms. Option B. Immediately schedule the patient for a nasolacrimal duct probing and irrigation procedure to address potential obstruction. Option C. Advise the patient to discontinue all eye care products and focus solely on managing the history of dacryocystitis with topical antibiotics. Option D. Perform a comprehensive tear film evaluation, including tear breakup time and Skirmer's test, and a thorough examination of the puncta and canaliculi, while also inquiring about the frequency and resolution of past dacryocystitis episodes. The correct answer is A. Initiate a trial of artificial tears and lubricating ointments, and schedule a follow-up appointment in 4 weeks to reassess symptoms. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient exhibits symptoms suggestive of a lacrimal system issue, specifically dry eye, but also has a history of recurrent dacryocystitis. Differentiating between these conditions and determining the appropriate management pathway requires a thorough understanding of lacrimal anatomy, physiology, and the potential interplay between different lacrimal system pathologies. The professional challenge lies in accurately diagnosing the primary cause of the patient's discomfort and ensuring that the chosen intervention addresses the root problem without exacerbating other existing conditions or overlooking a more serious underlying issue. This requires careful patient history, precise clinical examination, and an understanding of when to refer for further specialized evaluation. Correct approach analysis. The correct approach involves a comprehensive evaluation that includes assessing the tear film stability, evaluating the puncta and canaliculi for patency, and considering the possibility of a partial or intermittent obstruction in the nasolacrimal duct, especially given the history of dacryocystitis. This approach is justified by the need to identify the specific cause of the dry eye symptoms, which could be primary, e.g., evaporative dry eye, or secondary to a lacrimal drainage issue. By considering the history of dacryocystitis, the professional is adhering to best practices in differential diagnosis, recognizing that a history of infection in the lacrimal sac can predispose to chronic inflammation and altered tear dynamics, potentially leading to or mimicking dry eye. This thoroughness ensures that the patient receives appropriate treatment, whether it be for dry eye management, lacrimal probing, or further investigation of the nasolacrimal duct. Incorrect approaches analysis. An approach that solely focuses on lubricating eye drops without investigating the underlying cause of the dry eye symptoms, especially in a patient with a history of dacryocystitis, is professionally inadequate. This fails to address the potential for a mechanical obstruction or chronic inflammation contributing to the dry eye, which could lead to persistent discomfort and increased risk of infection. It represents a failure to conduct a complete diagnostic workup, an approach that immediately assumes a complete nasolacrimal duct obstruction and schedules surgical intervention without first thoroughly evaluating the tear film and ruling out other causes of dry eye, is also professionally unsound. This could lead to unnecessary invasive procedures and may not resolve the patient's primary complaint if the dry eye is not directly related to the obstruction. It bypasses essential diagnostic steps, an approach that dismisses the patient's dry eye symptoms as unrelated to the history of dacryocystitis and only treats the dacryocystitis without further investigation of the dry eye, is also a failure. The two conditions can be interconnected, and ignoring the dry eye symptoms could lead to a suboptimal patient outcome and a missed opportunity for comprehensive care. Professional reasoning. Professionals in this field must employ a systematic diagnostic process. This involves gathering a detailed patient history, performing a thorough physical examination, and utilizing appropriate diagnostic tests. When faced with complex presentations, such as a patient with both dry eye symptoms and a history of lacrimal system infection, it is crucial to consider all potential contributing factors. Decision-making should prioritize patient safety and well-being, ensuring that interventions are evidence-based and tailored to the individual's specific needs. This includes recognizing when to seek consultation or referral to a specialist for advanced diagnostics or treatment. Question 14. Consider a scenario where a patient reports experiencing double vision that seems to worsen when they look to their left and is described as one image being slightly above and to the left of the other. The Certified Ophthalmic Technician, COT, is tasked with performing an initial assessment. Which of the following approaches best aligns with the COT's responsibilities and the regulatory framework for ophthalmic technicians in the U.S.? Option A. Perform a comprehensive ocular motility assessment, including testing in all 9 cardinal positions of gaze, cover testing, and assessment of fusional reserves, while meticulously documenting any limitations or deviations observed. Option B. Conduct a basic visual acuity test and record the patient's description of double vision. Then inform the ophthalmologist that the patient is experiencing diplopia without performing any specific motility or alignment tests. Option C. Primarily focus on rechecking the patient's refractive error and spectacle prescription, assuming the double vision is a consequence of uncorrected refractive error. Option D. Advise the patient that double vision is often subjective and may be related to eye strain, recommending they rest their eyes and return if symptoms persist without further investigation. The correct answer is A. Perform a comprehensive ocular motility assessment, including testing in all 9 cardinal positions of gaze, cover testing, and assessment of fusional reserves, while meticulously documenting any limitations or deviations observed. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the Certified Ophthalmic Technician, COT, to interpret and act upon patient-reported symptoms that directly relate to the complex interplay of extraocular muscles, their innervation, and the resulting visual perception. The technician must differentiate between a subjective complaint and a potentially objective finding that could indicate a significant underlying condition affecting binocular vision. Failure to accurately assess and report such symptoms could lead to delayed diagnosis, inappropriate management, and potential harm to the patient's visual function and quality of life. The challenge lies in translating a patient's description of double vision into a systematic evaluation that considers the anatomical and physiological basis of eye movements. Correct approach analysis. The correct approach involves a systematic and thorough evaluation of the patient's reported diplopia. This begins with a detailed history to understand the characteristics of the double vision, e.g., monocular VS, binocular constant VS, intermittent, direction of separation. Following this, a comprehensive ocular motility assessment is crucial. This includes evaluating the range of motion of each eye in all 9 cardinal positions of gaze, assessing for any limitations or pain. Furthermore, specific tests for binocular vision, such as cover testing, alternating and unilateral, to detect phorias and tropias, and testing for fusion and stereopsis, are essential. The technician must also consider the potential innervation pathways of the extraocular muscles, cranial nerves Roman 3, Roman 4, and VI, and how their dysfunction can manifest. This detailed assessment allows the COT to identify the specific pattern of misalignment or motility deficit, which is critical for the ophthalmologist's diagnosis and treatment plan. This approach aligns with the ethical responsibility of the COT to provide accurate and comprehensive data to the supervising ophthalmologist, as mandated by professional standards and the scope of practice for COTs, which emphasizes assisting in the diagnosis and management of ophthalmic conditions. Incorrect approach is analysis. Dismissing the patient's complaint of diplopia as a subjective experience without further investigation is an unacceptable approach. This fails to acknowledge the potential for objective pathology affecting the extraocular muscles or their innervation, which can lead to significant visual impairment. Ethically, this constitutes a failure to provide adequate patient care and violates the principle of beneficence. Focusing solely on refractive error correction without a motility assessment is also an incorrect approach. While refractive errors can sometimes contribute to visual discomfort, diplopia, especially if binocular, is typically indicative of a misalignment problem that glasses alone cannot resolve. This approach neglects the core issue of binocular vision and extraocular muscle function, potentially delaying the diagnosis of conditions like strabismus or cranial nerve palsies. Performing only a basic visual acuity test and documenting the complaint without a detailed motility evaluation is insufficient. While visual acuity is a fundamental test, it does not provide information about the alignment or coordinated movement of the eyes. This limited assessment fails to gather the necessary data to understand the cause of the diplopia, thereby hindering the ophthalmologist's diagnostic process and potentially leading to an incomplete or inaccurate assessment of the patient's condition. Professional reasoning. When faced with a patient reporting diplopia, a COT should employ a structured decision-making process. First, prioritize the patient's subjective complaint and recognize its potential significance. Second, initiate a systematic data collection process that includes a detailed history and a comprehensive ocular motility and binocular vision assessment. Third, meticulously document all findings, noting any limitations in eye movements, deviations, or difficulties with fusion. Fourth, communicate these findings clearly and concisely to the supervising ophthalmologist, highlighting any concerning observations. This process ensures that all relevant information is gathered to facilitate an accurate diagnosis and appropriate management plan, upholding the COT's role as a vital member of the ophthalmic care team. Question 15. System analysis indicates a patient reports increasing difficulty reading small print and experiencing blurred vision when shifting focus from a distant object to a near one. The certified ophthalmic technician, COT, is tasked with evaluating the lens's contribution to these symptoms. Which of the following approaches best reflects a comprehensive assessment of the lens's structure and accommodative function in this scenario? Option A. Perform a subjective refraction for distance and near, and a basic slit lamp examination to note any gross opacities. Option B. Conduct a detailed patient history focusing on visual symptoms, measure uncorrected and corrected visual acuities at distance and near, assess accommodative amplitude, and perform a thorough slit lamp examination for lens opacities and position. Option C. Measure the patient's intraocular pressure and perform a dilated fundus examination to rule out posterior segment pathology. Option D. Rely solely on the patient's subjective report of difficulty with near vision and recommend over-the-counter reading glasses. The correct answer is A. Perform a subjective refraction for distance and near, and a basic slit lamp examination to note any gross opacities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified ophthalmic technician, COT, to interpret subtle clinical findings related to the lens and its function, specifically accommodation, and to correlate these findings with potential underlying pathologies like cataracts or dislocation. The challenge lies in accurately assessing the patient's subjective experience of visual changes and objectively measuring accommodative amplitude, then synthesizing this information to guide further diagnostic steps and patient management. Misinterpretation could lead to delayed diagnosis, inappropriate treatment, or patient dissatisfaction. The COT must demonstrate a thorough understanding of normal lens physiology and the various ways its structure and function can be compromised. Correct approach analysis. The correct approach involves a systematic evaluation that begins with a detailed patient history focusing on visual symptoms, followed by objective measurements of visual acuity at distance and near, and a comprehensive assessment of the lens's structural integrity and accommodative ability. This includes performing a thorough slit lamp examination to identify any opacities characteristic of cataracts and assessing the lens's position to rule out dislocation. Crucially, measuring the accommodative amplitude provides a quantifiable measure of the lens's ability to change focus, which is directly impacted by age-related changes, presbyopia, and can be affected by early cataracts or significant lens displacement. This multifaceted approach ensures all relevant aspects of lens function and structure are considered, aligning with best practices for comprehensive ophthalmic patient care as expected of a COT. This aligns with the ethical obligation to provide thorough and accurate patient assessments. Incorrect approaches analysis, focusing solely on distance visual acuity and ignoring near vision complaints or accommodative testing would be an incomplete assessment. This fails to address the patient's subjective experience of difficulty with near tasks, which is a common symptom of accommodative issues or early cataracts. Such an approach neglects a significant aspect of lens function and could lead to overlooking or delaying the diagnosis of conditions affecting near vision. Relying only on the slit lamp examination for opacities without assessing accommodative amplitude or considering the lens's position would also be insufficient. While identifying cataracts is important, it doesn't fully capture the functional impact on the patient's vision, particularly their ability to focus at different distances. Lens dislocation, while potentially visible on slit lamp, might not always present with obvious opacities and requires specific assessment of lens stability and position. Performing only subjective refraction without objective lens examination or accommodative testing would miss crucial structural and functional information. Subjective refraction primarily determines the refractive error, but does not directly assess the lens's physical state or its dynamic accommodative function, which are critical components of a comprehensive COT evaluation. Professional reasoning. When faced with a patient presenting with visual complaints that may involve the lens, a COT should employ a structured diagnostic process. This begins with active listening and detailed history taking to understand the patient's symptoms. This is followed by objective measurements, starting with basic visual acuity and progressing to more specialized tests relevant to the suspected pathology. For lens-related issues, this includes slit lamp examination for structural abnormalities, cataracts, dislocation, and functional assessments like accommodative amplitude measurement. The COT must then synthesize all gathered data to form a preliminary assessment and collaborate with the ophthalmologist for definitive diagnosis and treatment planning. This systematic, evidence-based approach ensures patient safety and optimal care. Question 16. Operational review demonstrates that the clinic's ophthalmic medication inventory is managed with varying levels of diligence. Several technicians have been observed to prioritize speed in dispensing over meticulous checks, and patient education on newly prescribed eye drops is often limited to a quick verbal summary. Considering the regulatory framework and ethical obligations for certified ophthalmic technicians, COT, in the U.S., which of the following approaches best ensures patient safety and treatment efficacy? Option A. Dispense medications promptly after a cursory check of the label and provide patients with standard written information leaflets without individual assessment of comprehension. Option B. Focus on streamlining the dispensing process to reduce patient wait times, assuming that most medications are within their expiration dates and that patients will understand basic instructions. Option C. Implement a rigorous protocol for verifying medication expiration dates and storage conditions for all dispensed medications, coupled with a comprehensive patient education process that includes demonstrating administration techniques and confirming patient understanding through teachback. Option D. Maintain detailed logs of all dispensed medications and their corresponding patient records, while delegating the responsibility for checking expiration dates and storage to a designated inventory manager. The correct answer is C. Implement a rigorous protocol for verifying medication expiration dates and storage conditions for all dispensed medications, coupled with a comprehensive patient education process that includes demonstrating administration techniques and confirming patient understanding through teachback. Explanation. This scenario presents a common yet critical challenge in ophthalmic practice, ensuring patient safety and treatment efficacy through proper medication handling and patient education. The professional challenge lies in the direct impact of medication errors on patient outcomes, potentially leading to reduced vision, adverse reactions, or treatment failure. The certified ophthalmic technician, COT, must navigate regulatory requirements, ethical obligations, and the practicalities of patient understanding. The correct approach emphasizes a multifaceted strategy that directly addresses the core components of medication management: proper storage, adherence to expiration dates, and comprehensive patient education. This aligns with the fundamental principles of patient care and the regulatory framework governing healthcare professionals, which mandates diligence in dispensing and instructing patients on medication use. Specifically, maintaining medications within recommended temperature ranges and discarding expired products are critical to ensuring their potency and safety, directly preventing harm to the patient. Furthermore, clear, understandable patient education on dosage, administration, and potential side effects is essential for compliance and to empower patients to manage their treatment effectively, thereby maximizing therapeutic benefit and minimizing risks. This approach reflects a commitment to patient well-being and adherence to professional standards of care. An incorrect approach that prioritizes speed over accuracy in dispensing medications, such as not verifying expiration dates or dispensing medications without confirming proper storage conditions, directly violates regulatory requirements and ethical duties. Failure to check expiration dates can lead to dispensing ineffective or potentially harmful medications, compromising patient safety and treatment outcomes. Similarly, neglecting proper storage can degrade medication efficacy. Another incorrect approach, which involves providing only a brief overview of medication instructions without assessing patient comprehension or offering opportunities for questions, fails to meet the standard of informed consent and patient education. This can result in patient noncompliance, incorrect usage, and adverse events, all of which are preventable through thorough instruction. A third incorrect approach, which focuses solely on the administrative aspects of medication logging without actively ensuring the physical integrity and appropriate dispensing of the medications themselves, overlooks the direct patient care responsibilities inherent in medication management. This administrative focus, while important, cannot substitute for the direct clinical responsibility of ensuring medication safety and efficacy at the point of patient interaction. Professional decision-making in such situations requires a systematic approach. First, always prioritize patient safety by adhering strictly to all established protocols for medication handling, storage, and dispensing. Second, meticulously verify all medication details, including expiration dates and lot numbers, before dispensing. Third, dedicate sufficient time to patient education, tailoring the information to the patient's understanding and confirming comprehension through teach-back methods. Finally, maintain accurate and complete documentation of all medication-related activities. Question 17. System analysis indicates a patient presents with acute onset of severe eye pain, photophobia, decreased vision, and a purulent discharge. The ophthalmologist suspects a microbial keratitis. As a certified ophthalmic technician, COT, what is the most appropriate initial course of action to ensure optimal patient care and adherence to regulatory guidelines? Option A. Advise the patient to use over-the-counter lubricating eye drops and return in 48 hours if symptoms persist. Option B. Immediately obtain corneal scrapings for gram stain, bacterial culture and sensitivity, and fungal staining, and prepare the patient for examination by the ophthalmologist. Option C. Initiate treatment with a broad-spectrum antibiotic eye drop based on the presumed diagnosis of bacterial keratitis. Option D. Rely solely on the patient's description of symptoms to determine the severity and recommend home care instructions. The correct answer is B. Immediately obtain corneal scrapings for gram stain, bacterial culture and sensitivity, and fungal staining, and prepare the patient for examination by the ophthalmologist. Explanation. This scenario presents a professional challenge due to the potential for rapid vision loss and the critical need for accurate diagnosis and appropriate management of an infectious ocular condition. The certified ophthalmic technician, COT, must exercise careful judgment to differentiate between various types of infections, each requiring distinct treatment protocols and posing different risks. Failure to correctly identify the causative agent or to implement timely, appropriate interventions can lead to irreversible damage, impacting the patient's quality of life, and potentially leading to legal or ethical repercussions for the technician and the practice. Adherence to established protocols and guidelines is paramount. The correct approach involves a systematic assessment that prioritizes patient safety and diagnostic accuracy, aligning with the ethical and regulatory standards governing ophthalmic practice. This includes meticulous history taking, thorough clinical examination, and appropriate specimen collection for laboratory analysis. The COT's role is to gather comprehensive data to support the ophthalmologist's diagnosis and treatment plan. This systematic approach ensures that all relevant information is considered, minimizing the risk of misdiagnosis or delayed treatment. Regulatory frameworks for COTs emphasize the importance of accurate documentation, patient education, and working within the scope of practice, all of which are integral to this approach. An incorrect approach that involves immediately initiating broad-spectrum antibiotic therapy without definitive diagnostic evidence is professionally unacceptable. This bypasses the crucial step of identifying the specific pathogen, which is essential for targeted treatment. Such an action could lead to the development of antibiotic resistance, ineffective treatment, or masking of the true underlying infection, all of which are detrimental to patient care and violate ethical principles of responsible medical practice. Furthermore, it may exceed the technician's scope of practice, which typically involves assisting the ophthalmologist rather than independently prescribing treatment. Another incorrect approach, such as solely relying on the patient's self-reported symptoms without a comprehensive clinical examination and diagnostic testing, is also professionally unacceptable. While patient history is important, it is often subjective and can be incomplete or misleading. Ophthalmic infections can present with varied and sometimes subtle signs that require objective clinical assessment. This approach risks misinterpreting the severity or nature of the infection, leading to inappropriate management and potentially serious consequences for the patient's vision. It fails to meet the standard of care expected of a COT, which includes performing thorough examinations and facilitating diagnostic processes. A third incorrect approach, which is to dismiss the patient's symptoms as minor and advise them to return only if symptoms worsen significantly, is highly problematic. This demonstrates a lack of urgency and a failure to recognize the potential for rapid progression of serious ocular infections. Such a passive approach neglects the COT's responsibility to ensure timely and appropriate medical attention for potentially sight-threatening conditions, deviates from the ethical imperative to act in the patient's best interest, and could result in significant harm due to delayed diagnosis and treatment. The professional decision-making process for similar situations should involve a structured approach. 1. Patient presentation. Thoroughly assess the patient's chief complaint and medical history. 2. Clinical examination. Conduct a comprehensive ophthalmic examination, noting all relevant signs and symptoms. 3. Differential diagnosis. Consider the range of possible infectious etiologies based on the clinical findings. 4. Diagnostic support. Facilitate necessary diagnostic tests, such as corneal scrapings for cultures or PCR, as directed by the ophthalmologist. 5. Communication. Clearly and accurately document all findings and communicate them to the supervising ophthalmologist. 6. Patient education. Provide clear instructions to the patient regarding follow-up care and warning signs. This systematic process ensures that all aspects of patient care are addressed, adhering to both ethical responsibilities and regulatory requirements. Question 18. Cost-benefit analysis shows that while standard fundus photography is less expensive, optical coherence tomography angiography, OCTA, offers more detailed vascular information for diagnosing retinal vascular occlusions. A clinic is considering implementing a protocol for suspected retinal vascular occlusions. Which approach best balances diagnostic efficacy with operational considerations, adhering to U.S. ophthalmic technician standards? Option A. Utilize standard fundus photography for all suspected retinal vascular occlusions to minimize immediate costs, deferring OCTA only if physician review deems it absolutely necessary. Option B. Implement a protocol where OCTA is performed for suspected retinal vascular occlusion when the patient's insurance explicitly covers it, otherwise using standard fundus photography. Option C. Mandate OCTA for all suspected retinal vascular occlusions to ensure the most comprehensive diagnostic data, regardless of initial cost. Option D. Train technicians to perform OCTA when clinically indicated for suspected retinal vascular occlusions, prioritizing diagnostic accuracy and timely patient management, while also being mindful of efficient workflow and appropriate resource utilization. Correct answer is C. Mandate OCTA for all suspected retinal vascular occlusion to ensure the most comprehensive diagnostic data, regardless of initial cost. Explanation. Scenario analysis. This scenario presents a common implementation challenge in ophthalmic practice, balancing the need for timely and accurate diagnostic imaging with resource constraints and patient throughput. The certified ophthalmic technician, COT, must make a judgment call that impacts patient care, workflow efficiency, and potentially the practice's financial health. The challenge lies in determining the most appropriate imaging modality for a patient presenting with symptoms suggestive of a retinal vascular occlusion, considering the urgency of diagnosis and the availability of different technologies. Correct approach analysis. The correct approach involves prioritizing the imaging modality that provides the most rapid and comprehensive diagnostic information for suspected retinal vascular occlusions, even if it incurs a slightly higher immediate cost. In the U.S. regulatory framework for ophthalmic technicians, adherence to established diagnostic protocols and the principle of providing the highest standard of care are paramount. Optical coherence tomography angiography, OCTA, is often the preferred modality for evaluating retinal vascular occlusions because it offers non-invasive visualization of retinal vasculature, allowing for rapid identification of perfusion defects and neovascularization, which are critical for diagnosis and management. This aligns with the ethical obligation to ensure accurate and timely diagnosis, which can significantly impact patient prognosis and treatment decisions. as guided by professional standards and the American Academy of Ophthalmology's preferred practice patterns. Incorrect approaches analysis. Implementing a policy that mandates the use of a less informative but cheaper imaging modality for all suspected retinal vascular occlusions, such as a standard fundus photograph without angiography, is an incorrect approach. This fails to meet the standard of care for diagnosing vascular occlusions, as it may miss subtle but critical vascular abnormalities that OCTA would readily identify. This could lead to delayed or incorrect diagnoses, violating the ethical duty to provide competent care and potentially contravening guidelines that emphasize diagnostic accuracy for sight-threatening conditions. Another incorrect approach would be to defer imaging decisions solely to the physician, without the technician performing initial, appropriate diagnostic imaging based on clinical suspicion. While the physician ultimately interprets the images, the COT's role includes performing diagnostic tests that are indicated by the patient's presentation. Delaying necessary imaging due to an overly cautious or restrictive protocol, or an abdication of the technician's diagnostic imaging responsibilities, can lead to significant delays in patient care, which is ethically unacceptable and can negatively impact patient outcomes. Finally, choosing an imaging modality based solely on the lowest immediate cost without considering its diagnostic efficacy for the specific condition is a flawed approach. While cost-effectiveness is a consideration in healthcare, it should not compromise the quality of diagnostic information or patient care. The regulatory and ethical framework emphasizes patient well-being and accurate diagnosis above mere cost savings when those savings lead to substandard care. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient welfare and diagnostic accuracy. This involves understanding the clinical presentation, knowing the diagnostic capabilities of available imaging modalities, and adhering to established clinical guidelines and ethical principles. When faced with a suspected sight-threatening condition like a retinal vascular occlusion, the technician should select the imaging modality that offers the most rapid and definitive diagnostic information, even if it involves a slightly higher upfront cost, as the long-term consequences of delayed or inaccurate diagnosis far outweigh immediate financial savings. This proactive approach ensures that patients receive timely and appropriate care, aligning with professional responsibilities and regulatory expectations. Question 19. The monitoring system demonstrates a patient presenting with symptoms consistent with a moderate corneal ulcer, and the prescribed treatment involves topical antibiotic drops. The patient, however, expresses significant anxiety about eye drops and requests to delay treatment until they can get used to the idea, despite understanding the potential for vision loss if the ulcer progresses. As a certified ophthalmic technician, COT, what is the most ethically and professionally appropriate immediate course of action? Option A. Agree to the patient's request to delay treatment for a few days, assuring them that it is unlikely to cause significant harm in the short term, and schedule a follow-up appointment. Option B. Immediately administer the eye drops to the patient, explaining that it is for their own good and that their anxiety is not a valid reason to refuse necessary medical intervention. Option C. Document the patient's refusal and inform the supervising ophthalmologist of the situation, but take no further action until the ophthalmologist provides specific instructions. Option D. Gently but firmly explain the urgency of the situation, the risks of delaying treatment for a corneal ulcer, and the importance of starting the prescribed medication immediately, while offering to demonstrate the application of the drops and provide reassurance. The correct answer is D. Gently but firmly explain the urgency of the situation, the risks of delaying treatment for a corneal ulcer, and the importance of starting the prescribed medication immediately, while offering to demonstrate the application of the drops and provide reassurance. Explanation. This scenario presents a professional challenge due to the potential conflict between a patient's expressed wishes and the technician's professional judgment regarding the appropriate course of action for their corneal health. The technician must navigate this ethical dilemma by prioritizing patient well-being and adhering to established professional standards and regulatory guidelines for ophthalmic care. The correct approach involves a thorough and empathetic discussion with the patient, explaining the risks and benefits of the recommended treatment for their diagnosed corneal condition, such as keratitis or a corneal ulcer. This approach aligns with the ethical principle of patient autonomy, ensuring the patient is fully informed and can make a decision based on accurate information. It also upholds the technician's responsibility to provide competent care and advocate for the patient's best interests, as mandated by professional codes of conduct and potentially by state or federal regulations governing healthcare practice, which emphasize informed consent and patient-centered care. An incorrect approach would be to dismiss the patient's concerns or to proceed with a treatment plan that the patient explicitly refuses without further investigation or consultation. This would violate the principle of informed consent, potentially leading to patient harm and a breach of professional ethics. Furthermore, failing to document the patient's refusal and the subsequent discussion could have legal and regulatory repercussions, as it demonstrates a lack of due diligence and adherence to patient care protocols. Another incorrect approach would be to unilaterally decide on a course of action without adequately assessing the patient's understanding or the severity of their condition, which disregards the collaborative nature of healthcare and the importance of patient engagement. Professionals should approach such situations by first actively listening to the patient's concerns and understanding their perspective. This should be followed by a clear, jargon-free explanation of the diagnosis, the recommended treatment, and alternative options, including the potential consequences of inaction. If the patient remains hesitant or refuses treatment, the professional should explore the reasons for their reluctance, offer further clarification, and involve the supervising ophthalmologist or physician to ensure the patient receives comprehensive care and that all ethical and regulatory obligations are met. Question 20. The efficiency study reveals that a patient presenting with a new complaint of intermittent double vision and a subtle, non-tender fullness in the upper outer quadrant of one orbit, with no apparent visual acuity deficit or external signs of trauma, is being discharged after a basic visual acuity and intraocular pressure check. What is the most appropriate next step for the ophthalmic technician to recommend to the referring physician? Option A. Advise the patient that the symptoms are likely benign and will resolve on their own. Option B. Recommend a referral for orbital imaging, such as a CT or MRI, and consultation with an ophthalmologist specializing in orbital disease. Option C. Document the findings and suggest the patient return if symptoms worsen significantly. Option D. Focus on prescribing corrective lenses to address the perceived refractive error contributing to the double vision. The correct answer is B. Recommend a referral for orbital imaging, such as a CT or MRI, and consultation with an ophthalmologist specializing in orbital disease. Explanation. Scenario analysis. This scenario presents a common challenge in ophthalmic practice where a patient's subjective symptoms, while concerning, may not immediately align with objective findings. The technician must navigate the potential for subtle but significant pathology, such as an orbital tumor, which can present with varied and sometimes nonspecific symptoms. The professional challenge lies in recognizing the limitations of initial assessment and understanding when further investigation is warranted, balancing patient comfort with diagnostic thoroughness, and adhering to established protocols for patient care and referral. Correct approach analysis. The correct approach involves recognizing that a patient reporting persistent, new-onset diplopia and proptosis, even without gross orbital wall abnormalities on initial palpation or visual acuity changes, necessitates further investigation. This is justified by the ethical obligation to provide comprehensive patient care and the regulatory framework that mandates appropriate diagnostic workup for potentially serious conditions. Specifically, the Certified Ophthalmic Technician, COT, is expected to follow established clinical pathways for evaluating orbital complaints. This includes performing a thorough orbital examination, documenting all findings meticulously, and escalating care by referring the patient for advanced imaging, e.g., CT or MRI, and consultation with an ophthalmologist specializing in orbital disease. This proactive approach ensures that conditions like orbital tumors, which can have significant functional and aesthetic consequences if delayed, are identified and managed promptly. Incorrect approach is analysis. Dismissing the patient's symptoms due to the absence of immediate, obvious signs of trauma or infection is a significant ethical and regulatory failure. This approach neglects the patient's subjective experience and the potential for insidious pathology. It violates the principle of beneficence, which requires acting in the patient's best interest, and could lead to delayed diagnosis and treatment, potentially worsening the outcome. Focusing solely on visual acuity and intraocular pressure as the primary indicators of ocular health overlooks the broader scope of ophthalmic assessment, particularly when orbital symptoms are present. While these are crucial parameters, they do not adequately address the complex structures of the orbit and their potential pathologies. This narrow focus fails to meet the standard of care for evaluating orbital complaints. Reassuring the patient without a comprehensive workup and referral based on the absence of immediate alarming signs is professionally irresponsible. This approach can create a false sense of security and delay necessary diagnostic steps. It demonstrates a lack of adherence to the principle of non-maleficence, as it risks harm through inaction or delayed intervention. Professional reasoning. When faced with a patient presenting with new-onset orbital symptoms like diplopia and proptosis, a COT should employ a systematic approach. This involves 1. Thoroughly documenting the patient's chief complaint and history of present illness, including the onset, duration, and character of symptoms. 2. Conducting a comprehensive ocular and orbital examination, including visual acuity, extraocular motility assessment, palpation of the orbit, assessment for proptosis or in ophthalmos, and evaluation of eyelid position and integrity. 3. Correlating subjective symptoms with objective findings. 4. Recognizing the limitations of initial assessment and understanding when advanced imaging or specialist consultation is indicated. 5. Adhering to practice guidelines and protocols for the management of orbital complaints, which typically involve referral for imaging and specialist evaluation for persistent or concerning symptoms. 6. Communicating findings and recommendations clearly to the patient and the referring physician.